My name's Dr. David Ende. I'm a urologist at St Vincent's Hospital in Sydney. Erectile dysfunction is the inability to achieve and maintain an erection sufficient for sexual activity or intercourse. The risk of erectile dysfunction after treatment for prostate cancer really varies on the treatment that you've had. It can be associated with hormone treatment or surgery or radiation. With hormone treatment, one of the side effects is to lose your libido and erectile function. With surgery, the nerves that are associated with erections are very close to the prostate and often get injured or stretched or cut when we remove the prostate. So we have techniques where we can spare those nerves either in part or in whole, but erectile function is never guaranteed after surgery. And I think it's really important that men are realistic about their sexual function after treatment. It depends a lot on their erectile function prior to treatment as to how well it will function after treatment. Erectile dysfunction can also occur after radiotherapy, but the full effect may not be noticed until 6 or 12 months later. Realistically, a lot of men are affected by erectile dysfunction after treatment. It really depends a lot on the characteristics of the cancer and the treatment modality that's chosen. Also, as I mentioned, a lot of men have erectile dysfunction prior to treatment, and at least 50% of men would have some degree of erectile dysfunction by the age of 50. It's hard to give a precise figure of erectile dysfunction rates after treatment, but I think, as I also mentioned, men have to be very aware that it's a high possibility. With surgery, many men are spared erectile dysfunction because the nerves can be saved. With radiotherapy, however, I think most men will end up with a degree of erectile dysfunction, as the radiation definitely will affect the nerves to some degree. In some cases, erectile dysfunction after surgery will resolve if the nerves have just been stretched or bruised. If, however, the nerves have been injured, it's not necessarily the case that they will recover. I think the management of erectile dysfunction really begins before this treatment is started. Men need to be very aware of the risks and the likelihood that they might have erectile dysfunction. After the surgery, there are penile rehabilitation programs that men can undertake. Usually this involves the use of medications in the first instance. There are also devices such as vacuum pumps that help to increase blood flow into the penis. If this doesn't work, there are injection therapies that men can use to help achieve erections. And again, if that doesn't work, they may need to consider a penile prosthesis. There usually is a very well described stepwise process that men would undertake to achieve erections if that's what they wish. If a man chooses to have a penile prosthesis placed, this involves an operation that usually takes about 1 to 2 hours and involves placing inflatable cylinders in the penis. If a man wants to undertake sexual activity, it's a small matter to inflate the cylinders with a pump that sits in the scrotum and then deflate it afterwards. It's a fairly straightforward operation, and men generally have a very high satisfaction rate, as do their partners. It is, however, the end-stage treatment for erectile dysfunction. Any treatment for prostate cancer really involves a long journey, and there are lots of potential risks and side effects, both physical and emotional, and erectile dysfunction is really just one of those that the men need to understand. And it takes a long time for men to get their head around what may or may not happen after their treatment. So I think being well aware of what may happen and having realistic expectations is really important in the outcome at the end.